How are you, you handsome boy?
He was born in 15 and with a heart condition, known as transposition of the greater arteries, and ended up requiring a transplant. And thankfully, the ACA had already taken effect. But now that's something that we think about all the time, especially with his coverage, the potential of coverage maxes, and his initial hospital stay was over $3 million that was billed back to the insurance.
I remember thinking as Bo lay dying in bed, and we'd lie in bed with him, his brother and I and his sister, and thinking to myself, what in God's name would I do if the doctor walked in and said, I'm sorry, you've outrun your insurance, you've reached your cap, suffer the last few months of your life on your own.
I came from a part of the country, rural Missouri, where basically everybody was a Republican and I was a Republican. And I lost my voice. And we put off going to the doctor because we didn't have health insurance. When we finally got into somebody that could take a look at my throat, they said, wow, you've got cancer. It was stage 4, the worst kind of cancer you can have. My wife applied for insurance through the Affordable Care Act, and my coverage began on April 1st in 2012. And that same day, they started my chemo and radiation, and it saved my life. I'm here today.
Generally speaking, as a church, you're concerned about people spiritually, but you're also concerned about other areas of their life. And that includes their physical or physiological well-being, because the Bible talks about all of us. But there are people in our country, and in fact, people in my church that can't take advantage of it because they don't have good health care. That's pretty discouraging to me, and that's pretty discouraging to them.
Because of the myasthenia gravis and the fact that it's a very rare disease, a lot of our medications we have to fight for. And before the ACA, we worried about our medications. We worried about the pre-existing conditions for our children. We worried about age and the cap, because having that cost of the medications, we would have reached that $1 million cap in no time. But once the ACA passed, we no longer had that cap of the $1 million.
The fear that you all live in, understandably, if somehow tomorrow they said no insurance, you're not covered, is just devastating. Hey, Laura, how are you doing?
Yes, again.
How you doing? Well, you beat Hodgkin's lymphoma. God love you. But during it all, Trump was trying to rip away your coverage. The day you got your first chemo, Republicans voted to gut the ACA. I can't imagine what it must have been like going to sleep at night wondering what to do.
Ever since I was diagnosed, every night I'd go to bed concerned about what news I would get in the morning. And even today, they're still trying to take away our health care, even during a pandemic.
Look, we're going to make sure we don't lose that ACA. We're going to provide a Medicare-like option as a public option. And any state where there is if you qualify for Medicaid and the state hasn't provided it, you'd automatically be enrolled. I'm going to protect you like I tried to protect my own family. And I promise you that.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.